Thank you, Dr. Minal and Dr. Venugopal, for giving this opportunity. My respected teachers and all friends. So before I start my topic, let me ask one question to the PGs. Have you published a paper by now? Have you presented a paper in a scientific research, this scientific committee? No, any of the conferences, have you presented a paper? Or have you written a research paper? I think most of you must have written, isn't it? So my sincere request is you need to write, because it will increase the understanding level of the subject as well as visibility of the subject. That is important for the rehabilitation of the PMR. Writing paper will improve our visibility. That will help us to improve the quality of PMR and rehabilitation of those working in PMR. So this is very important thing for us. My topic is it's not actually PMR, not very related. Just like Dr. Venugopal started with the horrific pictures, it is more like a comedy as a part of the movie. So I will try to incorporate the lesson learned when I was editor of a journal called Journal of Medical Sciences that was indexed in Embase, Scopus, and Index Medicus, Index Ecumenicus. So I'll try to incorporate my lesson that I learned from there. So by default, I was the editor-in-chief of the most high textbook, that is Indian this textbook of the IPMR, textbook of the PMR. So what is important in research is planning and the checklist. Very often it is very difficult to do a U-turn in research. That's why we should be very particular from the very beginning. So proper planning is the key. So if you somebody continue despite knowing the fact that there is some problem, then many end up cooking the whole paper, and that is not reproducible. And India is popular for producing so many papers that is not reproducible, that you cannot publish. Yes. So the first and foremost important thing before you write a research, before you start a research, is the design. So depending on, are you doing an interventional study or you are doing an observational study? If you are doing interventional, is it randomized control? It is non-randomized, non-control, or is it quasi-experimental? If you are doing observational study, are you doing a descriptive study where we consider case report and case series, or analytical, consists of cross-sectional, case control, or cohort study? You have to mention this. And many of you, when you submit your paper, right, it is a prospective study, it is a retrospective study. This doesn't have a meaning. You have to mention one of this. And that's why I say, you select the bus, right bus, otherwise your destination is questioned. You may not go, you may not find a place. So this is most important step in research is design. So this is not very important for you. When I was editor, I use this in the workplace where I check whether it is a parametric, non-parametric data, it is a continuous data, it's a categorical data, it is of normal distribution or non-normal distribution. Then you know what actually test is to be done. So this is not for you, but for me. Well, I'm not a physician, but like to see whether there is a gross mistake or not. So the research papers are many. So it depends on the level of evidence. You can understand meta-analysis is the best, systemic review. Then critical appraisal studies are the guidelines that we develop, consensus statement coming up. Then the randomized control study, randomized non-control studies, then cohort study. These are the level of evidences. But commonly what we find is original research article, systemic review, meta-analysis, then case report, case series, so on and so forth. But please remember, this one, National Medical Commission recognizes only the original articles, systemic review, meta-analysis, and a case series. They don't recognize the remaining. Only 4 research papers are recognized. That is original research articles, maybe RCT or non-RCT, systemic reviews, meta-analysis or the systemic reviews, and case series are considered by the NMC, not others. So how to select a journal for publication? So we see the scope of the journal, the impact factor, reputation, the indexing bodies, peer review system. Is it open access or subscription? Open access has more visibility. The acceptance rate, the publication fees, then they follow the standardistics, and we should be all be careful about the predatory practices. Maynard Joshi is very much after the predatory. He said, don't do this. And citation potential is important, visibility is important, equally important, and of late, all metrics means using the social medias. So NMC approved only 1, 2, 3, 4, 5 indexing bodies, namely Medline or PubMed, the Embase, the Scopus, Science Index, Citation Index Expanded, Directory of Open Access Journal. Our journal is presently indexed in Directory of Open Access Journal. It is also approved by the NMC. So whenever you want to publish, you have these days, you have to select this. So if you see, I published one of the articles relating to the trauma, to the brain, into the rehabilitation after the trauma, because this is my specialty, even when it was not even indexed. Because unless when we find a very good article, we send to US or UK, because that will improve their impact factor only. If you want to improve our own impact factor, you put your article in our journal. That will improve our impact factor. This is what I want to request everyone. I also put one of the article, that was my this ICMR project. So that was published in May 2024. Why I published? It is because the Indian Journal of Medical Research is one of the highest impact medical journal in the country. It is indexed in almost all the indexing bodies, and the impact factor is around 4.2, very high. And difficulty was that it took time. It took nearly 2 years to review. So depending on that, we also published, one of my students he's from here, Rajasthan, published one paper in International Journal of PMR. It was published within 4 months' time, and they charged 1.18 lakhs. We paid 1.8 only, anyway. But that charge was too much. That was not okay. They're within our actually pocket. So we had to pay around 18,000. So there are many. So you have to select depending on what I have said, like all other things, acceptance rate, publication rate. ICMR, this acceptance rate is very, very low in India list. So whenever you publish an article, you have to follow a structure format. Structure. It includes the title, the abstract, that includes the keywords, introduction, material methods or methodology, results, discussion, conclusion, acknowledgement, conflict of interest, references. So if you want to see everything about this, I always prefer to see a journal in New England Journal of Medicine. They've really followed this very strictly. And otherwise, the format we follow internationally is called IMRAD. IMRAD is for I is for introduction, M is for methods, R is for result, and D is for discussion. I want to convey that poor experiment remain poor throughout, but poor writing may destroy a brilliant experiment. So be careful about writing. So when we write a title, what should we write? And that is again very important. So I compare, when we go up for a movie, first and foremost important thing to me is what is the title. The title must be attractive and accurate. After that, when I feel that it is very attractive, then I see the trailer before seeing the whole movie. So the title is the title of the movie. Title is good, should be good, and the abstract of the article must be, the trailer must be very attractive and accurate. So both are very important for us. So the reading of remaining part of the article depends on how good is your title and how good is the abstract. So make it very attractive. People do not find time, they will read only these two. So there are a few points to be included. It should be descriptive, specific, and standalone. And now as a standard to put study design in the title. Okay, so avoid abbreviations, no abbreviations. It should be in active voice, usually 15 words, and the keywords must be included in the title because that is a gateway to the search engines. So to a starter in my institute, to learn more of a research methodology, we always ask our students to do a comparative study. So let me just, this is one hypothetical this research that we do in our institute. This is hypothetical, not actually what we do. So I said comparative effectiveness of intra-articular injection of erythropoietin and the platelet-rich plasma in reducing pain and improving in function in osteoarthritis of knee, a randomized control study. So we used, remember the word, if you remember, in statistics, we say PICO. Now it is also known as PICOT. P is the population. Population is osteoarthritis. Intervention is intra-articular injections of the two medicine. Then we are comparing the efficacy. And what is the outcome? Outcome is reducing pain and improving function. This is taken as a standard title. And on the top of that, we have included a randomized control study. This became a standard protocol. So there are many ways to write. This is not necessarily the title that you should PICO is do you follow it? No, you can have your own titles. But to start to know methodology, it is better to have comparative study. It is better to compare with something always. But to remember, if you are doing a randomized controlled trial, the control medicine must be a standard care for that particular disease. You cannot keep a placebo as a control now. So about writing the abstract. So what we write in the abstract, we write the background, we introduce the problem. If I am using osteoarthritis, I introduce this. I introduce the interventions like EPO and PRP. Then what is the objective? Okay, so then after that, we summarize the design. Then, as I said, the setting, the participants, interventions, and the key procedures. What is the procedure followed? In short, results, the most important one is highlighted with relevant data, and the result must be supported by the statistical significance, and most of the time it should be there. The conclusion we provide the main conclusion that we call the primary outcomes, especially in my case, is going to be pain and improvement in function. So that should be concluded what happened in your study. There maybe 4 or 5 keywords must be there. It must be there. You cannot have a reference in the abstract. People started keeping references. There cannot be any reference in the abstract. And usually standard is 250 is the maximum one. It is written in active voice, and some of the sentences you have to write in the simple past tense. So coming to the writing and introduction. So first what we do, we introduce the topic, we introduce the interventions, and the literature, the relevant literature to explain what is already known. You need to know what is already known. Okay, then what is important, what is already known, what is not known, and you develop a gap. To bridge the gap, you develop a hypothesis, then you develop an objective out of that. And how your finding is going to implicate, what will be the implication of your study, and what will be the Like, okay, so what is the novelty component? At the end, please remember the end paragraph of any introduction is the objective of your study. Make sure that you write this at the end. That is the objective of your study at the end of the introduction. So what do you know? What you don't know? Then what is the gap between? Bridge the gap by developing your hypothesis. Then objectives. Okay. Once if you achieve the objective, then you know what you are going to get, implications of what you study. Okay. So please don't forget this part. So if you see this, these are the sample. This is not originally the one I put a sample. So introduce the topic, the relevant literature, introduce the intervention, relevant literature, what is the gap in the knowledge, what is the novelty, what is the objective, what is the hypothesis. So these are to be included in the introduction. So this is called complete. What do you write in methodology? First and foremost important thing is this is the backbone of your research, not the introduction. So what is the study design? This must be very, very concrete from the very beginning. And what is the setting, like where it is done? Then the time frame. Coming to the participants, like what is the study population? What is the inclusion criteria, exclusion criteria? What is the sample size? How it was determined? Please remember, some of the Western and American journals, they ask you to provide a copy, how you calculated. If you don't write properly, they ask you a separate question. You explain how it was calculated now as a matter of importance. Then if you are doing a study that is interventional, you need to take REB proposal approval. Okay, if you are doing other studies, you need only REB approval. If you are doing an interventional study, you need controlled trial registry. Without this, you cannot publish. Both of them are required. So but for the interventions, without this, you cannot publish. You cannot run after this later on, because this controlled trial registry will not allow you to do it. They will start processing the moment you receive. Before that, they won't allow you to do it. So make sure that if you are doing an interventional study, get approval from Research Ethics Board. After that, apply to the controlled trial registry. You get very fast. Within 1 month, you will get the result. Okay, that should be available. That is important at the time of publication of the journal. They will not publish without that. Then in that method, you have to explain properly the procedure in the control in the study group, and what are the tools we use, how strong are the tools that you use, and we should clearly mention what was the statistical software that you used, the test, very clearly you should mention the test that was used to find out the statistical significance. And if there are limitations, and that should be also mentioned. If there are missing points like dropouts and no response, that should be mentioned. And in this, so this is study design. In my case, is a randomized double-blind controlled trial. This is a very strong technique, and the duration was for 12 weeks. And then I compare EPO with PRP in osteoarthritis grade 2 and 3. Those 60 participants, if it is asked how you calculated, then we'll give a separate note on that. So they were selected, and who are included, who are excluded is given. How you do the randomization? Randomization was done. So it was a convenience sampling, and the randomization was done by computer-generated randomization sequences. These are to be written. Sampling and the randomization are to be written very clearly. You cannot just say, I do randomized technique. What randomization? Have you done a block randomization? Simple randomization. So that is important to answer. So these things should be answered. What are the interventions you have done? What intervention do? What you do should be clearly written. So in my case, I use EPO of 4,000 international unit. So then the 3 ml of the PRP. Then outcome measures were the BAS score and OMAG score as baseline 6 and 12 weeks. Statistical analysis, I use SPSS. And for the continuous variables, between groups comparison, I use independent t-test. For categorical variables analysis, and the chi-square test was used. and p-value was this. So ethical consideration, so approval is very, very important, but in the note, in the methodology, you have to write that informed consent is this line. They want to see whether informed consent is taken or not. You make sure that it's there, and followed by this RAB approval was also taken. And if you have done a control registration, please write the control registration number also. That will strengthen your study and presentation. Well, coming to the result, first, what you write in the result? First paragraph is on the patient's characteristics. Make sure that if you are comparing two groups, there should be, these two groups must be comparable. You said that these two groups are comparable. If they are not comparable, from the very beginning, you cannot compare. So make sure, this is the first paragraph that you should be writing. Then our main focus is on primary outcome. In my case, is pain and improvement in function. So how it behaves in at the end of the 12 weeks. So here I have shown that there was 44% improvement in the EPO group and in the pain, and 33% in the PRP group. In the functional, one is 35% improvement in the EPO group and 30% improvement in the PRP group. No significant, statistically significant, but both of them improve the function. But in case of the pain, EPO gives better result than the PRP. So what secondary outcome I have seen, is there any improvement in the range of the motion or patient satisfaction? So there was no statistically significant difference in between the two. So, please do not forget, if you are doing any interventional study, please do not forget to mention any adverse. It is bound to happen. If you don't mention it, you miss it. So I mentioned here that adverse effects were mild and self-limited with no significant difference in incidence of adverse effect between the group. This is to be adverse. If you do intervention, mention this adverse effect for sure. So coming to the discussion, so result is what you find, and the discussion is what do this finding means to you? That is called discussion. So we put the result. So what we find is there is both improvement of pain and function in both the cases, but pain improvement was better in case of EPO. I need to explain why this erythropoietin has given a better result. So these things are to be analyzed, and in the line of the published literature. It is so I have written. So I compare this result with other things, though these things are to be maintained. So you have to compare with the previous studies, whether it is aligned or not, and you should write a clinical implication of what you find. So we are finding that EPO is better, becoming an alternative treatment option, offering enhanced pain relief without any need of the more invasive therapy. So if new emerges of EPO as a novel therapy in osteoarthritis, this is the implication of the study. Coming to what is the strength of the study? These are all to be mentioned. You make a checklist, you write something on this, then it becomes a complete paper. My strength in this study, hypothetical study, is it is a randomized, double-blind design that will minimize bias and enhance validity. So that becomes very strong. Limitation means short period study, so long-term result we don't know. That is my limitation. And further research, we want that long-term research should be done. We should know more about the dosing and the clinical profile. We need more research done. And writing discussion, the end paragraph is a conclusion. There will be another conclusion. But here also, without writing conclusion, you should write what you find. So writing conclusion is we write only the main findings summary based on my primary outcome and improvement result was my primary aim. So that should be what you find, it should be written. And if you have good literature, you compare with the existing literature, okay, then so I also written, if you read the second paragraph, this finding aligned with the previous studies of PRP, but suggests EPO may offer an alternative treatment option with potential better benefit. So This is what I have written. The implication I have said, limitation I have told you, recommendation I have done it. Always, in the conclusion, conclude with a concluding statement. Make a very strong that, okay, so I have written, what I have written is, in conclusion, PRP remains a popular, is reasonable treatment for ONE. Intra-articular EPO shows promise as a novel therapy, particularly in terms of pain management. Further, large-scale randomized controlled trial are recommended to solidify these findings and a guide to clinical decision-making. This is, and please make sure that many of the conclusions are written from the knowledges the person gathered from the books. Many of the conclusions are written from the books, not from the study. That is what we come across. Please don't do that. What you find in the paper that you have done, project, please write those. Not your, don't write your knowledge. Don't try to show your knowledge. So no new thing, no new finding. I want to add some more. Okay, to writing references, we strictly follow the International Committee of Medical Journal Editors uniform requirement of manuscript. It has given what is to be written what. And most important is the references. And many of the good journals follow this very strictly. And if you want to see this, I always prefer to read, all of you to read at least one article published in New England Journal of Medicine. This is very, very standard way of writing an article. Okay, so otherwise, some follow, many do not follow this. So when you write, you follow where for whom you are writing. So but make sure that reference is complete. Many references in India is very, very incomplete, half-heartedly done. It should be incomplete and accurate. And please include recent and relevant literature. Why recent? Because medical science is the most fastest growing science. If you write anything beyond 20 years, it becomes a historical perspective. So make it very, very recent as far as possible. So don't forget to write acknowledgement. This is for those, only all those who contributed to you, but not to thank all the authors and your family members. Don't mention all the authors and your family members. And at least acknowledge the sources of funding and the grants. And the conflict of interest must be declared, disclosed, declared. And before that, I want to add that now New England Journal has started, ICMA Journal has started, many of the universities have started. They said that you should declare that no part of this article is taken out from AI. I don't use AI to write this article. So New England Journal, ICMR, and many of the thesis written, you have to declare that it is there, we don't use. There are different ways to check AI now. It is very easy to check now unless you humanize. Okay, so now AI writing thesis in 1 hour. So now we have to check. So general tips for writing, I am concluding, general tips for writing the paper is it should be very clear, concise, don't write a literature. Consistency is a key. Check grammar error, grammatical errors and typos. This is a problem for us Indians, especially for me, checking grammatical errors and typos. Check ultimate again and again, comply all ethical standard. And I always consider colleagues' review time and again. That makes it perfect. And if you follow these 7 C's, then last 8 is you conquer. Then you are successful. And my only suggestion to you all, I always suggest, as I don't say that you write bad, but like you send it to your friends. Multiple proofreading is very good. Some may improve the content, some may improve the scientific content, some may improve the English, and some may improve the format. Ultimately, you get what you want to get. And at the end, the honesty in the planning, in the conducting, as well as publication, is the best policy. And we need to follow, just like clinical ethics, there is something called publication ethics, and that must be safeguarded. And it is us to safeguard it. It's time to stop copy and paste. And what we are seeing, 2 things, one is introduction, one is discussion, is a place where we all cut and paste. So please stop doing it. This is very important. We can easily understand that you have got an passage. This is time to stop this one and make sure that please you don't do it. And once you write it with all morality and from heart, probably we give the best science. Any science, any paper, any science we produce must be reproducible. Many of the articles in India, if you do again, you won't find the same result. That's the reason why and another problem is many of the research we do is duplicate, repetitive research. This you cannot publish anywhere. I wrote a very good article in 2009 about the hemiplegic shoulder management, and I submitted to the Neurology International. So within 2 weeks, I got a letter from the editor journal, said, Dr. Joy, you have done a very good job and you have written so well, but I'm sorry to say that there is no new information in this article. Okay, I learned a lesson. Okay, so whenever you want to do any research, put a topic, maybe in AI also, then you will find similar articles. Or if you want to go a little away, then you get many choice that you can change your article, the name in this way. But like starting from this, and okay, people start looking from there only from title itself. Title, you must be very, very careful. No duplicacy, okay, no repetitive research. And we are doing because we want to pass exam. Many of these are repetitive, so none of your research could be published except for the accredited journals where you pay money. And don't be very happy with that. And thank you so much.
If no question from the PG, actually Joy sir, in one mnemonic Joy sir has said this PCOD, but he didn't describe what D stand for. So any PG can say what exactly D stand for in PICOD. No, PICOD. Yes.
My students can answer easily. So
you can say T also, PCOT. PCOT is also okay. And one more mnemonic I am giving you for writing an original article, that is finer maps. Any PG can elaborate what exactly stand for this finer map. FINER MAPS. Okay. F stand for feasibility. I stand for innovation or interesting. N for novelty. E for ethical. R for realistic. Or M for measurability, P for reproducibility, R in fact also stand for reproducibility, P for potential of publication, and S for suitability. So if you are writing an original article, please try to mention these two in your mind, these PCOTs and the finer maps.
Through Manal, I am getting many journal for review. Then now I can tell which article is coming from which place, because like it is prototype of the okay. So but like things are complete. Well, you plan properly, and through that plan you make a checklist and complete the checklist. Make sure that your checklist answer. Then that is a good paper. Nobody can deny that.
And please send most of the article to our IJPMR. Okay, now it is indexed, so you cannot complain that our journal is not indexed, and we are moving in fact forward direction to make it PubMed index under the leadership of Akoijam Joy sir. But unless until you give this article to our journal, it is not going to be, the dream not going to be true or realized.
And another thing that we note is most of the research papers are very successful. All the interventions in the case control group, they're significantly significant, and all the interventions are always successful. So if we were so successful, I think we would have reached somewhere. Unfortunately, so the moment you say, because see, the peer reviewers are moving around, they are like checking thesis or reviewing paper or maybe doing some review for a book or something like that. And then you come across like PRP and say, what is that? Pressure ulcer. Not a single article even has non-significant result. All research papers have a very, very significant result. And how can that happen? It is just If you are doing a PRP for knees, it's very, very successful. But we did, so I was interested in doing this saphenous block, and we did that research, and we couldn't see that the effect doesn't last even 15 days. So it was a failure. So even though it was a failure, we published it. That's fine. Like, it's a learning experience. So don't think that that a successful conclusion is only the right research. So you will fail. And if you fail 100 times, maybe one will be a big shot, a sixer. So anyway,
PRP is not without complications. Yeah. You may find next morning, you may find lots of swelling. And when once your P value, you said highly significant, we become extremely suspicious. We want to test your data.
so thank you, Dr.
Thank you very
Joy.